The Prime Minister's signature.
The latest national census report released on Thursday shows that 18.4% of Ugandans aged 10 years and above are experiencing probable psychological distress. Additionally, 0.9% of individuals have had suicidal thoughts or attempts, while 7.8% reported lost interest in activities they previously enjoyed. At least 12.9% of respondents displayed extreme emotions and mood swings, suggesting the presence of disorders such as bipolar.
We are using the term probable because here there are no experts to do more thorough screening, because we understand this is usually done in the community with experts or at the health facilities. So that's why we have those non-committal statements.
The National Census report also noted that cases of mental health distress are more prevalent among women than men.
But also it is not that it was unexpected. The different studies that have been done have showed that women in some of these disorders had higher ratings. The predisposing factors or the risk factors for psychological distress or mental illness did not affect us the same.
However, the Ministry of Health says that this data was based on basic questions and there is need for more detailed assessment and comprehensive study to determine the prevalence of mental health conditions in the country.
As a ministry, we've requested, there's a team of experts that have been put together. We are going to to see how to analyze that data further. And where possible, for me, I feel we need to have a proper mental health prevalence study, because these small things may not really lead us into anything. People could have said yes and they were not, or they could have said no and they are.
Because for the longest time we did not have any figures to go with. But also the fact that they were included is an indicator that we are normalizing the mental health conversation, that they're integrating it in the other functions and policies. I cannot say that they are very, very concrete figures, because first of all, these were self-reported results. And they come with some of their challenges, There's a social desirability biases that someone doesn't want to look bad.
The ministry indicates that the number of people seeking mental health services at different health facilities has increased. However, despite the rise in demand, mental health facilities remain inadequate.
There's infrastructure at the regional referral and even at Hotabika. It's so clear. But these places are small. For instance, Hotabika is supposed to be, I think, over 650-bed hospital. But they're housing more than that. It's double the number now. So again, infrastructure needs to be improved at that point, where many more people are coming in and many more people have to be served. And unfortunately, when people come in for admission, it's that they need to take a long time.
According to the Health Ministry, funding shortages remain a challenge. Mental health services are underfunded, leading to a shortage of mental health professionals in facilities and essential medicine.
There are very few of the mental health providers within communities. There are some districts which do not even have a mental health provider, and that's a shame. But well, it's there. Like, there's no mental health expert within the community, within a district. So these people are going to suffer. Of course, no one, in case people are sick, they will not be treated. Then the other thing is about the medicines. Most of the psychotropic medicines are actually expensive. They're very expensive. And when it comes to budgets within facilities, they will put some medicine, yes, but it will not be enough for the people who are there.
But mental health experts are calling on Ugandans to take responsibility for their own mental well-being, practice positive mental health habits.
Because before we get into challenges, we all have mental health. It is existing. So how good or how bad it is depends on how well you're taking care of yourself, regardless or irregardless of the prevailing environmental factors. Because sometimes you have to look at it and see that factors might not go away. Those affecting a woman might not be, yes, there might be interventions to it, like, but menopause, it will occur, or PMS, your menstrual cycle will come.
NOBERT ATUKUNDA, NTV Weekend Edition.